Hi, my name is Kale Evans. I'm a student nurse here at Wilson State College, and today I'll be performing reconstituting medications, drawing medications from a vial and an ampule, and administering medications to the patient. So the first step is I'm in the med room and I'm going to perform hand hygiene, and then I'm going to start looking at my medication records as well as my provider orders for my patient who's going to receive these medications. So my patient is Shirley Koss, 54-year-old female, and that's what it's telling me on the provider orders. And so on my med record, that's also what it says, Shirley Koss, 54-year-old female, as well as a date of birth of 5/14/1964, and that matches as well. So now that I know that I have the correct provider orders as well as medication record, I can then go on to matching the medications on the list. So the first one I have on the provider order is a PPD test on the right arm, and that is on my MAR as well, purified protein derivatives, or PPD, and it says to dilute it to 0.1 mils. And so the next one is going to be my ceftriaxone, 250 milligrams IMOD, and that's my next medication, ceftriaxone, 250 milligrams IMOD. And lastly, I have my Phenergan, 25 milligrams IM BID PRN, and that's their Phenergan, which is promethazine hydrochloride, and that's 25 milligrams IM BID PRN. So it is PRN, so it is as needed, and I was with the patient earlier to get vitals, and she was complaining of nausea, and that's what Phenergan is for. So I will go in to administer that, and then the ceftriaxone, that is for infection, and then the PPD test is her TB test. So now that I know that all of these match, then I can discard the provider orders, and I can go on to start checking her medications off with my MAR. Before I do that, I'm going to check my MAR with the bin itself to make sure I have the correct patient's bin. So again, it's Shirley Koss, 54-year-old female, and that matches as well as the date of birth of 5/14/1964, and that matches as well. So this is her bin. So I know that I can then begin pulling the medications out of the bin. So the first one again is that purified protein derivative. So that's going to be not there. So tuberculin purified protein derivative. And it is a powder, so I do know that I'm going to need sterile water to dilute it. And it's telling me that I'm going to need 3 mils to dilute. Okay. And then I'll pull the 0.1 mils when I'm ready. And then next is that ceftriaxone, 250 milligrams, and that's here, 250 milligrams ceftriaxone. And it is also powder, so I'll also need to bring sterile water out for that. And then lastly is that Phenergan, which is that promethazine hydrochloride, 25 milligrams. And here's that promethazine, and this is a single dose ampule, and it says that it's 50 milligrams per milliliter. And so I know through dimensional analysis that I'll just be drawing up half of a mil from this ampule. So that concludes my first med check, and so then I can go on to performing my second med check as well as drawing up the medications. So here's just the tray that I'm just going to be bringing into the patient's room with me with the medications on it. And I have my labels, a Band-Aid, and gauze, which I'll be needing in the patient's room as well. So I'll just set those to this side. And I can start with my PPD. And so that is, let's see here, make sure I got the right ones. So there's my PPD, and there is my sterile water, and I'm going to start by uncapping those and wiping them down with a alcohol swab for 10 to 15 seconds just to disinfect. Okay, so there's one. there's 2, and again that is my TB PPD. Okay, so that can go in the garbage. And then I'm going to pull out my 3 mil 23 gauge syringe and needle. I twist it on. And I will be pulling in 3 mils of air. So there's my 3 mils of air. And then it's just going to go into the sterile water. And push it in. And then I'll invert and make sure my needle is completely submerged, and I can then start pulling liquid. There I'm at 3 mils, so then I can invert, pull my needle out, and then I can go in and put this in. And then I can pull this out and put on the safety lock and dispose of this. And then I'm just going to roll this around just to make sure the medication is mixed up. Making sure all the powder is dissolved and diluted. And give it a couple upside downs to make sure I get any medications that might be on the cap. Give it a few more rolls. Never want to shake it because that can create air bubbles. Okay, and I just want to make sure I got no powder still in there. Okay, so that's ready. Okay, so I can get rid of that. And then I'm going to wipe down the vial again, because then I'm going to be drawing it up in the TB syringe. So again, this is for 10 to 15 seconds, just gonna wipe it down. And then we're gonna get our TB syringe out. And we're gonna pull out 0.1 mils, and this is a 1 mil syringe. Okay, so I'm just gonna uncap it and withdraw to 0.1 mils so that I have that air. So there's 0.1. And then I'm just gonna insert it into the med vial and squeeze that air in, and then invert the medication and pull out 0.1. And there we're at 0.1, so then we can pull that out and use the safety sweep and put that back on. Make sure we got it on, and then I can get rid of that vial. And then I'm gonna have to label it so that I know which of the medications this is. So this is my PPD for tuberculin, and it is 0.1 mil. And I'm gonna initial and give the date and time, which is at 9:30, and then today's date is 10/4/19. And then we'll just put that around the needle, and so that one's ready to go. Okay, and then next we're going to move on to the ceftriaxone, 250 milligrams IM. And again, that is another powdered one. So we're gonna uncap these again. And we're going to wipe them down as we did with the previous ones for 10 to 15 seconds. So there's the sterile water wiped down. And next we'll go on to the medication. And that's for 10 to 15 seconds as well. And again, just to confirm my second med check, it's ceftriaxone, 250 milligrams, 250 milligrams. So I can then start with my syringe and needle. And then this one is also the 3 mil 23 gauge. Screw that on. And pull it out. And then we're gonna do the 3 mils of air again. There's our 3 mils of air. And that's going to go into the sterile water. And we're going to invert and pull 3 mils of water out again. And then we're at 3 mils at eye level, so I can invert and pull the needle out. And then I can put it into the medication. Okay. Then I can do the safety sweep. And discard the sterile water and then mix. Again, inverting to make sure I get anything that's in the cap. Okay, and we're all mixed up. So then we're gonna switch needles, because then I'm going to be withdrawing, so I'll just put the cap in, sharps, and get out this 21 gauge. And then this medication, we're not going to be administering in the skills video. This is just to show how to withdraw. And so I'm going to be pulling out 1 mil of medication from the vial. So I'll pull it to 1 mil, insert it. Before I do that, I have to wipe it down again. After I mixed it, you always gotta wipe down your vials. So that's again for 10 to 15 seconds. Okay, so now we're ready. So I still got that 1 mil of air in there. Okay, and I can uncap and push that in. Squeeze the air out. And then we're going to be pulling out that 1 mil, making sure the needle's fully submerged. And we can just start pulling out that medication. And reading it at eye level. There is my 1 mil of medication. I'm using a safety sweep. I'll put the needle back on, making sure to get any air bubbles out. And then we're going to label this one as well. So that's the ceftriaxone at 250 milligrams, and we got my initials and the date and time, 9:30 meds, and it is 10:4:19. And then we'll wrap that one up. Okay, and lastly we will be going on to the fenner again. Just gonna clean up my workspace a little bit. All those away. So the fenner again, promethazine hydrochloride, that's 25 milligrams as needed, and when I went in for vitals, she was complaining of nausea, so we're going to give this is a 50 milligram per milliliter, so I know that I'm only going to be getting half of a mil out of this ampule. So again, just like with the vials, you want to disinfect them with an alcohol swab, making sure to get all of the top, and then where it's going to break, you want to make sure that that's clean as well. Okay. And then I'm going to want to break it towards me. But first, so I'm going to want to break it towards me so that any glass that shatters goes away from me. Okay. And then that can go into the sharps bin. I can set that down and prepare my needle. So this needle is a 3 ml syringe, ruler lock, and then this is a filtered needle, and the filtered needle is needed in case any glass shards got into the ampule, that it is big enough and it has mesh in there that'll filter out any particles of glass. So again, I'll just uncap it, and we'll just be withdrawing half of 0.5 of mils. Okay, and I do have a little bit of an air bubble in there, so I'm just going to make sure to pull out a little extra. Okay. And then when I pull it out, I'm just going to get that air bubble out of there, make sure I got the correct medication in there. And there goes the air bubble. And we're right at 0.5. So then I'm going to do the safety sweep and get the needle tip cover back on. And I will be disposing of that needle as well as that later. And then I'll just be putting on this 21 gauge needle. If I can get my hands to open it. And then we're going to fill out our final medication card. So that's the Phenergan, and it is 25 milligrams, initial it, and it's going to be given at 9:30 on 10/4/19. We'll wrap that one up. Before I leave, I can clean up my workspace in here. I would discard of the vials per the company policy on how they would have them disposed of. I get a big glove. Do some hand hygiene again, and then I would be able to head into the patient's room. So I'm going to be going to the patient's room. I'm going to bring my MAR with me. So knock knock. Hey there, Shirley. How you doing today? I'm Kale. I'll be your nurse today, and I've just got some injections, some medications for you. So again, I'm just going to need you to verify your name and date of birth. Okay, Shirley Coaster, 4 female. And that matches my MAR. And your date of birth, what did you say it was? 5/14/64? Okay, perfect. So I'm going to have my gloves here. And so just to go over with you, Shirley, I got your, I got a PPD test, which is your tuberculosis test. We're going to be doing that. And then I also have your Flanagan, because when I was in here earlier, you were saying that you were a little nauseous. Are you still nauseous? Yeah? Okay. So we'll give that to you too. And so now that I can give that final check, I'll put on gloves. And so that first one's going to be that tuberculin test. So I'm going to make sure I still got it here. So it's the PPD tuberculin. Okay, PPD tuberculin. And so that one's just going to be done underneath the first layer of skin. So we're just going to uncap that. And I just want to make sure I can get a new spot that doesn't have any poked holes in it, so I don't have any leakage or any sort. And then I want to make sure that the tip is on top. And stretch the skin. And then we're going to feel a little poke, okay, Shirley? 1, 2, 3. Okay. And then we're going to go in with this just to try and make that. And then we're going to cap it. And so that one's done. And then next we're going to do the Flanagan, which is in the arm. So we're just going to uncap that one. Got an old Band-Aid on here. And I'm just going to have my Band-Aid ready here as well. Okay. And before I do that, I'm going to wipe down the patient's arm. Starting in the middle and going out. And then I'm going to check again. That's the Flanagan. Okay, and then we're just going to pop that off. Okay, Shirley, so you're going to feel a slight poke. Okay, 1, 2, 3. And we're just going to go nice and slow at a rate of, since it's going to go about 0.1 per second, so we're going to go at about 5 seconds. Okay, and then we're just going to hold it there for a couple seconds. And then when I retract it, I'll cover it with the gauze and massage it. So there's that. I'll start massaging and safety cap this. Massage. And then we'll get this Band-Aid ready. That Band-Aid on you. Perfect. Okay. And then I'll put those back on my tray and I'll be taking them out with me. I would dispose of my gloves, perform hand hygiene, make sure that the patient is lower to the floor and that they're sitting comfortably if they don't need anything from me. Then I would go back to the nurse station chart. I would also dispose of the ampule in the correct, as the policy calls for, and these needles would then go into the sharps container as well when I still have gloves on.